This week's show is sponsored by Celebrate Vitamins, providing the optimum level of vitamin and mineral supplementation that's tasty and affordable. Get all of your favorite Celebrate products at celebratevitamins.com. This week's episode of Bariatric TV is sponsored by Bariatric Advantage, the most complete line of micronutrient replacements specifically designed for the weight loss surgery patient. Help support the show by ordering your Bariatric Advantage products directly from the BTV e-store.
Hi, I'm Linda.
And I'm Tony. Welcome to BTV. Told you we would be back.
What do you have for us this week? What have you done for me lately? Could you just do a show for us? What do we have for you this week? Baka did it.
What the heck is a stricture?
When it comes to complications, do your research.
And food on the forum.
Food fight.
Now I know you all know Ian, because he's a great guy.
He's one of our most active forum members and goes by the moniker of Baka. And on the forums, he's always ready to offer up a word of advice or just provide a virtual shoulder to lean on.
And that means we're proud to feature our friend Ian on this week's I Freakin Did It. And boy, did he.
Check out this picture. Wow. Ian said, I freaking did it. 8 months post-op, I can now fit in one leg of my 60-inch waist Tubby Boy Pants that were so snug on me in July of '09.
A huge congrats and a way to go, Ian.
Nice work, Baka!
Now, while Baka's getting out of his pants, we'll head on over to the dumping ground.
I don't feel good.
Welcome to the dumping ground. These last few weeks, we've had several forum members ask about strictures.
Karen posted asking what was up with the uber foamies ectoplasm. I'm sorry, but that description just cracks me up because it's so true.
She said that basically every time she eats, she gets the mega foamies and has to hurl up her food. Not good.
But it could be an easy diagnosis, an easy fix with the help of her doc.
Strictures, did your surgeon's office tell you about them?
Or are you one of those folks that have no idea what a stricture is?
Plain and simple, a stricture is when your stoma, the point where the food leaves your pouch, closes up. Basically, it heals too well, meaning you can no longer eat and eventually drinking can become difficult. It's pretty serious.
Okay, it's serious. But just how common are strictures?
Various medical literature shows rates of strictures at 1 to 10% of patients.
But how do you know if you have one? I mean, you could easily mistake the symptoms as a stomach flu.
If everything you are eating or drinking is coming back up with a plethora of foamies, you need to check it out with your doctor. Seriously, seek help.
But if your doc does diagnose you with a stricture, what was the cause? Was it your fault?
Nope, not your fault at all. Strictures can be related to poor healing due to patient issues like smoking, vascular disease, or diabetes.
Well, hold on. If you had poor healing due to smoking,
Right, so
then it is your fault.
well, yeah, kind of, if you're drinking and smoking and...
It can also be caused by tissue-related issues like tension on the gastrojejunastromy or gastrojejunal
Gastrojejunastromy?
It's like tension on the gastrojejunastromy, a gastrojejunal
Why do you
anastomotic.
always want to put an R in there? Gastrojejunastromy makes it sound like an Italian dish.
I'm Italian.
Here's a nice gastrojejunastromy. You want a nice Chianti? Go with that, eh? Gastrojejunastromy.
GJJ.
On the JJ.
On the GJJ. Just put the word down there.
It could also be caused by tissue-related issues like tension on the or gastrojejunal anastomotic. No.
Gastrojejunal anastomotic ulcer.
A gastrojejunal anastomotic ulcer, a small opening created at the time of surgery, or poor blood supply in the anastomosis.
Anastomosis?
You're just trying to make me look stupid.
Working!
Or poor blood supply in the
Anastomosis.
anastomosis. In many cases, no one knows for sure. I'm done. I don't want to do this section anymore.
To put it in layman's terms, they're basically caused by an overabundance of scar tissue.
If you're diagnosed with a stricture, your doctor will schedule you for a gastroendoscopy. During this procedure, they'll stretch out the stoma by inflating a balloon in the opening. Sometimes this procedure may have to be performed more than once for a permanent fix.
Bottom line here, folks, is that you shouldn't mess around with this. Left untreated, dehydration is just around the corner.
So, give your doctor a call and have him give you a hand at...
Yes?
I gotta go do it again. Okay, so we chatted a bit about strictures, but what about other complications that can pop up during or after weight loss surgery?
Hopefully you guys and gals are doing your research so that you're fully armed with all the information you need to make an informed decision about this life-altering surgery.
But just in case your surgeon hasn't clued you in,
Or you're just getting started and haven't gotten to this part in your research,
we thought we would quickly run down some of the complications that may occur in conjunction with bariatric surgery. And before anyone suggests it, we aren't doing this to scare you, simply to inform you.
First, the minor risks. Any major surgery will bring minor risks for complications that usually last for a short period of time. Most don't turn out to be anything more than a temporary inconvenience.
Post-surgery, many patients report experience minor setbacks that usually last anywhere from a few days to a few months. These minor risks include infections, hair thinning, hair loss, emotional distress, and gallstones.
There are also more serious risks that can affect patients and their overall health for the rest of their lives. Patients have reported experiencing everything from heart attacks to internal bleeding. Some patients also experience gastrointestinal problems that can cause everything from nausea to diarrhea.
There are also potential fatal risks. Surgery can cause complications that result in death. Luckily, technological advances minimize these risks, but it's important to know all aspects of weight loss surgery.
One potentially fatal risk is known as leaking. Leaking occurs when the connection between the stomach pouch tears and leaks stomach acids into the body. These acids are toxic outside the stomach and can result in patient death if not noticed and corrected quickly.
Though weight loss surgery can pose a risk of death, it's important to note that death rate for weight loss surgery patients are less than 1%.
And on the flip side, morbidly obese people can reduce their chances of weight-related death by nearly 90% by choosing to undergo surgery.
Last but not least, there are long-term risks. The greatest potential for surgery-related complications is during the 3 to 6 months after the weight loss surgery itself. However, patients can and do experience complications long after their surgery.
One common complication is needing corrective surgery. 20% of gastric bypass patients require follow-up surgery to fix health problems that develop, such as hernias.
Also, nutritional deficiencies can result from maintaining an improper diet. These deficiencies can cause chronic anemia and osteoporosis.
However, the most common long-term complications is the potential for gaining back the weight. The stomach pouch can stretch, allowing patients to consume more food and gain back what they've lost.
We have several members on our forums who've experienced complications, some immediately after surgery like a stricture, and others who experience more long-term and debilitating ones.
If you're interested in discussing more about complications, we'll be adding a complications board to our forum, which you can find at bariatrictv.com/forum.
For Linda and myself, surgery was one of the best decisions in both our lives, but it isn't for everyone. You need to do your research and prepare yourself to freak on. Welcome to the Freak On segment. This week, we're going to make it all about us.
Now, I'm sure you folks have been enjoying McNee's protein cooking videos. I absolutely love the carnitas recipe he did.
But we also have some great recipes on our forums. So many that I can't visit our forums anymore when I'm hungry. There are just too many yummy recipes being posted there.
Case in point.
You can do it.
All right.
I know you can.
Have you seen the cacophony of culinary concoctions coming out of T2's kitchen? It's a cornucopia of cuisine.
Nicely done.
Seriously, that woman is a southern whirlwind.
She spends entire weekends in her kitchen testing out recipes so that she can tell us whether they are yummy or yucky, freak-worthy, or best left on the side of the virtual highway.
And she's not the only one. We have some pretty talented chef types on the forums. So if you haven't checked out the food and stuff section, we highly suggest you give it the once over.
So, go put your peepers on a smorgasbord of superfluous supper stuffs that some of our forum folks have devised, tested, tweaked, and then tweeted and posted. But eat a little something first, so you're not tempted to snack while reading.
Yeah, we don't want you to be getting any drool.